Hello, and welcome back to the second episode of So You're Thinking About Therapy. In the first episode, we established that the mental health industry is designed to accept almost anyone. Now we are going to talk about should you go to therapy. After all, just because we can do something does not mean we should. We're going to look at this question from many different ways, but again, I'll answer the question now just to save some time and suspense. The answer, of course, is yes. Let's start with a hypothetical. Pretend that your problem is not an emotional behavior or mental health problem, but instead a medical problem. This actually makes a lot of sense, since the mental health industry is based off of the medical model. For better or for worse, that's just how it is. So pretend instead of anxiety or depression or whatever problem you have, you wake up and you see a teeny tiny spot on your foot. And of course you naturally Google it, and Google, trying its best, gives you a whole range of what it could be. It could be a spider bite, a pimple, and of course typical cancer. So what do you do with this? Well, if you're smart, unlike my father, you will go in and talk to a medical professional. And most of the time, the problem is nothing. They tell you it's a bug bite, or will go in a couple days, they'll throw a cream at you, tell you to have a good day, and if you're in America, give you a bill. If it's something more extreme, such as the dreaded cancer, you'll be grateful that you didn't wait on it. The earlier you catch a problem, the easier it is to manage, and that's the same with mental health problems as well. I've seen a lot of clients who have been dealing with the problem for a long time, and I've heard every excuse they can think of as to why they waited until now to seek help, that they can manage the problem. They don't want to make a thing out of it. Asking for help seems like a weakness, etc., etc. And in some ways, they did manage it, obviously. They're still here, but they suffered a lot through it. Damage has been done to their life, either financially, with relationships, or in other areas of functioning, or just plain misery, and the problem only grew. If they had gone in months, or even a few weeks before, the problem would not have been this intense. Treatment might have been shorter, and they would have suffered a lot less. The damage would be a lot less too. Another point I want to make is the concept of using resources. I've heard clients share that they didn't feel like they should waste resources, like a therapist or a program, when their problem is, in their mind, only a 3 out of 10. I have a couple of points I want to make about this. First, is your problem really a 3 out of 10? In my experience, people will often underestimate the pain and the severity of how much they're struggling. There's this notion that people with mental health issues just want attention. And this is especially true with the teen population. But from what I've seen, it's the opposite. People will often try to hide their problems from everyone, try not to be a nuisance, not try to be the center of attention. And again, I've heard all the excuses. Now, I generally ask, why would someone who wants attention hide their problem and stall on getting help? So I would ask you a question: if your problem is really as minor as you say it is, or if you're just trying to not be, quote, dramatic. The other point I want to make here is there is currently no lack of resources in the mental health field. There might be in the nonprofit sector, I will admit that. Nonprofit organizations like the VA or DCFS, the local Department of Children and Family Services, they are often overworked and underpaid. But for most mental health outpatient therapy, you're going to be going to a private practice organization that you will find with your insurance. And I can tell you from my own personal experience that there is no lack of resources. Actually, quite the opposite. It's a growing field, and it was especially growing during COVID. A lot of organizations hired a lot during COVID because the need was there. And now that the need is over, there's a lot of therapists who are lacking clients. There are always therapists trying to increase their caseloads. There are also always new therapists who are trying to start a caseload. Do not underestimate new therapists, by the way. They have the passion and the drive and the willingness to try new things. You may be doing a therapist a favor, actually, by reaching out to help, not bothering them. Now I want to pivot here and ask a question that might seem a little weird, and that is, what is a mental health issue? What qualifies as a mental health diagnosis? After all, that is the main thing a therapist will help with, mental health disorders. And figuring out if you have a mental health disorder may be harder than it seems. First, it's a hard thing to admit that you have a mental health disorder. It shouldn't be. There shouldn't be any stigma with it, but there is. And if you've been struggling for a long time, let's say with anxiety, then having constant anxiety is kind of your baseline. You might not even be aware that you are suffering from it. It's just always been this way, and you may not realize that other people do not have such anxious thoughts. So what is a mental health disorder? There are lots of different types of mental health disorders. The DSM, the list of all mental health disorders, as acknowledged by the American Psychological Association, APA, is currently in its 5th edition. Diagnoses have been removed and added from each edition. So obviously the concept of what a mental health disorder has changed over the last century, since the field of psychology was created. One of the most famous examples, and the one that is often debated, is the removal of homosexuality as a diagnosis. The last time it was seen in the DSM was in the DSM-3. There was also the removal of Asperger's from the most recent DSM, with the philosophy that autism spectrum disorder is a spectrum, and we all fall on it to some degree. Mental health disorders can be labeled by a few things, and I would like to start with some things that it is not. It is not being weird. It is also not being crazy. Us therapists do not like such words. They are no-no words in therapy. There are two main parts that make something a mental health disorder. They are thoughts, emotions, or behaviors. I think that's pretty self-explanatory. But all humans have thoughts, behaviors, and emotions, as well as most animals. Well, maybe not thoughts. I don't know if a starfish thinks. So anyway, when do the behaviors, thoughts, and emotions become a mental health disorder? Well, the second part can be of one of two options. The first is when the thoughts, feelings, or behaviors start to interfere with your life. Let's pretend there was someone who really likes to clean. We can call them anal, though I hate that word for more than one reason. But his cleanliness does not interfere with anything. They can take care of their family, hold down a job, have free time, etc. They might be annoying to others, and people might even accuse him of having OCD. He doesn't, but there's no mental health concern at this time. Now let's say his desire to keep things clean increases to the point that they start missing work or neglecting their family due to the fact that they have to clean the walls with a toothbrush every day. Now we might be looking at a mental health struggle. And this is the big difference between a mental health disorder and what I would refer to as a quirk. A quirk might be annoying, it might even be disappointing to others, but essentially it's harmless. A mental health issue does damage to the sufferer's life and to the lives of those around them. The impact of functioning might be seen in a variety of ways. We already discussed missing work or taking care of the family, and that is often the most seen. Depression can make you want to sleep through work or not be with your family. Anxiety can keep you from going out. The impact could be more than that. For example, some mental health disorders might affect your physical health, such as eating disorders or substance use disorders. Extreme depression or anxiety can make you over or undereat. A lot of mental health disorders affect sleep. Some extreme mental health concerns can lead one into the legal system. Functionality is something that is often assessed in the first session. A topic some therapists will ask about is your day-to-day functioning. They might just flat out ask, "Tell me about your day-to-day." I, as a therapist, love this question. There are many reasons why a therapist will ask this question. It gives us a lot of information, but one of the main things they are assessing is how the problem has impacted your life. So you may be worried now because the problem might not be affecting your functioning, but you are miserable. Alive on the outside, dead on the inside. Well, that's the second option here for what qualifies for a mental health disorder. If the thoughts, feelings, or behaviors decrease your quality of life, most likely this is a mental health disorder. If you are internally miserable, most likely that will qualify for some diagnosis. This is just not my theory, it is backed by the DSM. Let's look at the criteria of generalized anxiety disorder. Criteria reads, the anxiety, worry, or physical symptoms cause clinical significant distress or impairment in social, occupational, or other areas of life functioning. A lot of diagnoses in the DSM have something similar to this criteria. Almost all of them, I would say, have something similar to this. For most therapists, including myself, the bar to hit that criteria is not high, and you do not really have to prove it. As talked about in the last podcast, a therapist will most likely take the word of the client when it comes to how the problem is impacting their life, either internally or externally. This is often why some things that are labeled mental health disorders by those who are not in the field are not actually mental health disorders. Again, such as being weird. You might be weird, and I don't think that's a bad thing, I'm weird. You might dress weird or have weird beliefs or watch anime, but if it's not impacting your life and it's not causing you distress, then it is not a mental health problem. A side note, judgment from others does not count in these things. This is about you. If you feel like this represents you, then therapy might be the best way to go. I understand coming to peace with the fact that you have a mental health disorder can be overwhelming. I will get more into the myths about mental health disorders and therapy in the next episode, but for now, I just want to say that this does not define you. You are more than your depression, your anxiety, your whatever. You are a beautiful person, as cliche as that sounds, and you deserve to tackle this problem with loving kindness for yourself. If a loved one was going through this, what would you say to them? Would you tell them that they are crazy or insane? Or would you show them compassion and try to help them? If so, you should do the same for yourself. Anything else is a double standard, and frankly, just cruel to yourself. So getting back to the question of, should you go to therapy? If someone who has a mental health disorder, even a mild one, should not go to therapy, then who should? You deserve peace. You deserve kindness. You deserve to take an hour out of your whole week so you can live more as yourself. You deserve help. I hope you enjoyed this second episode of So You're Thinking About Therapy. I hope it has helped you in your mental health journey. If it did, please consider subscribing or sharing this with someone who might need help. Join me next time where we talk about myths of mental health and therapy. Good luck on your mental health journey.